Hey everyone, today we are going to finish up the appendicular skeleton by talking about the lower limb. Anchoring the lower limbs to the exoskeleton is the first part of the lower appendicular skeleton known as the pelvic girdle. We talked about a girdle in the upper limb. That was the pectoral girdle, which anchored the upper limb to the exoskeleton. The pelvic girdle, again, will anchor the lower limb to the exoskeleton. It's made up of two ossa coxae, which are plural for os coxa. So there's one, and there's the other. And then it's also made up of the sacrum and the coccyx, which we learned about in the exoskeleton. So focusing on the ossa coxae, each one is made up of 3 bones that fuse, and we can make the division like so. So if I said ID bone, you would say os coxa, but if I said ID bone be specific, this one would be the ilium. ID bone be specific, this one would be the ischium. ID bone be specific, this one would be the pubis. And then the socket created, where all 3 of them come together, is known as the acetabulum. The acetabulum should always be lateral because this is where the head of the femur will articulate with the hip. This is essentially the hip joint. So the acetabulum is lateral. It's right near your acetabulum. Most students want to pronounce this acetabulum, but again, it's acetabulum. And then lastly, this hole that you see right here is the obturator foramen. In our terminology lecture, we learned that the word foramen meant hole, so this one is called the obturator foramen. Okay, so let's move over to our Word document and draw this out. So I am looking at a lateral view of a right os coxa. And we're also going to be looking at a medial view of a right os coxa, so I'm going to go ahead and draw that right now as well. Okay, so let's take some black here. Actually, let's make it red. And we're going to divide up my 3 bones. Okay, everything I write in purple will be a feature of the ilium. So you can see the ilium from lateral and medial. Everything I write in pink will be a feature of the ischium, sometimes pronounced ischium. And then everything I write in green will be part of the pubis. Okay, going back to our PowerPoint here, we talked about the acetabulum and the obturator foramen, so let's go ahead and mark those. I'll draw them in blue as they are features shared by multiple bones. So there's the acetabulum on the lateral side, and then you can see the obturator foramen from both views. Like so. Okay, now focusing on the ilium. We have a couple of different features. Looking medially, we have a low ridge, which we learned about in our bone terminology lab, as a line. So this line that you see right here is called the arcuate line because it creates a little bit of an arc on the inside of the pelvis. If you follow this arcuate line up, you will see an ear-shaped area called the auricular surface. Auricular referring to ear-shaped, and this is where the sacrum and the os coxa will come together. So, ID feature, this is the arcuate line, and ID feature, that's the auricular surface. Now, a prominent ridge is known as a crest, and the ilium has one big one right there, and this is the part that you feel when you put your hands on your hips. So that's the iliac crest. Posteriorly, we have this big old notch here known as the greater sciatic notch. This is where the sciatic nerve comes out from the spinal cord from. There are some muscles located here, and if they are swollen and kind of put pressure on that sciatic nerve, you can experience sciatica, which results in this kind of shooting pain and numbness down the lower limb. So the sciatic notch is a good tool to use for posterior versus anterior, and the acetabulum is good to tell you that you're looking at the medial or the lateral side of the os coxa. So going back to our picture, here, again, focusing on the medial side, I have the arcuate line right there. I'll darken it up. And then I have the auricular surface, which again is where the sacrum will attach to the ilium. Let me show you that on a slide. So if I were to peel off the sacrum right here, then you would see an auricular surface on the ilium. Okay, during our terminology lab, I had mentioned to you that a slender bony projection was known as a spine. And I said in the ilium, we have 5 different spines, and then I threw these crazy long terms at you. And I said, don't worry, we'll learn about those later. Well, now is later. But if you look at them on this PowerPoint, these are all words that you are now familiar with. So anterior means towards the front, superior means above, iliac refers to the ilium, and then spine is a slender bony projection. So this right here would be the anterior superior iliac spine. And if I have an anterior superior, I should probably have an anterior inferior iliac spine. If I have anterior versions of these spines, I probably have posterior versions. So this is a posterior superior iliac spine, and this is a posterior inferior iliac spine right near that auricular surface. So really you can see these spines from both the anterior and, both the medial and lateral sides. So we're going to go back over to our picture here and label them on all sides. So So we've labeled the anterior superior and the anterior inferior iliac spines. Now I have my posterior superior iliac spine here, as well as the posterior inferior iliac spine. And then same thing on this side, posterior superior iliac spine, and then posterior inferior iliac spine. Now, if you feel your iliac crests, which are right here, and you follow those anteriorly to where they come to a point, the spine that you are feeling at the very front part of your hips is the anterior superior iliac spine. So that's a good little mark for you to remember. Okay, so that covers all the features that we're learning for the ilium. If you would like, you can go ahead and pause this now and then practice some of your labeling exercises and then come back to do the ischium and the pubis. All right, focusing on the ischium. The ischium is this lower bone right here, often called the butt bone. In fact, this large rough area, which we'll identify in a moment, is the part you actually sit on. So the ischium is typically the most inferior part of the os coxa. Now, it also contains the last slender bony projection or spine that we have yet to identify, and that is the ischial spine. So that's just saying it's a spine that is located on the ischium. Then just below that, we have the greater sciatic notch here. Here we have a smaller version called the lesser sciatic notch, where a branch from the sciatic nerve may run. This large rough area on the ischium is known as the ischial tuberosity. Ischial referring to the ischium and tuberosity referring to large rough area. And then, if you notice, anytime we divided the ischium from the pubis, this angled bar of bone down here, which is a ramus, gets divided in half. This half that's closest to the ischium is known as the ischial ramus or ramus of the ischium. The second half of this ramus belongs to the pubis and has a different name. Okay, so that's really it for the ischium. Let's go back to our Word document and label it. So I have the ischial spine here. Below that, this little itty bitty notch is the lesser sciatic notch. And then this rough area here is the ischial tuberosity. And then this half of the ramus here would be the ramus of the ischium. So we can label the same things from the medial view. So this is your ischial spine. My lesser sciatic notch. And then the ischial tuberosity, which is your actual butt bone, the part that you sit on. And then here, the ramus of the ischium. Okay, again, you can stop and go to some labeling exercises to practice on the ischium. And when you're done with that, come back and we can go over the pubis. Okay, so the pubis is the last bone of the os coxa. There are quite a few different features on it, but we're only going to learn two of them for this class, and that is the superior pubic ramus. So that's that angled bar of bone at the top of the pubis. And then the second half of that first ramus we learned about belongs to the pubis, so we call it the inferior pubic ramus. So this would be ID feature, superior pubic ramus, and then ID feature, inferior pubic ramus. So adding that into our drawings here. the superior pubic ramus, and then down here, inferior pubic ramus. Okay, so that concludes the ossicoxy, except for the fact that you need to side them. So in the upper limb, you had to side the scapula, the humerus, and the ulna. In the lower limb, you'll have to side the os coxa, as well as the femur and the tibia. So let's do that before you take a moment to practice some labeling on the os coxa. So when we're looking at the os coxa, like we do any other bone that we need to side, we have to find something that will tell us the difference between where the anterior side of the os coxa is and the posterior side. So I use the greater sciatic notch because I know it should always face posteriorly. And for medial versus lateral, I always use the acetabulum, which tells me this should be lateral. So knowing that, I can tell that this is a right hip bone, or a right os coxa. Okay, go ahead and take some time to, again, label your ossicoxy either in Canvas or Connect or both, and then when you're ready, come back and we'll finish up the lower limb. Okay, looking at the lower limb, there are 30 bones per lower limb. Again, I don't like to use the word leg, but the entire lower limb. And students get pretty overwhelmed by that, but if you look, we have 14 phalanges and 5 metatarsals. And remember, just like in the hand, these all have the same name. They just vary by number. So there's not that many different bones we have to learn. Okay, the first bone of the lower limb is the femur, and it's in the femoral region or the thigh region. We are looking at a posterior view of it. There's way more features on the posterior side to identify than the anterior side. So when we're looking at our femora, most often we will be, again, looking at that posterior side. The femora of our bodies typically are the longest and strongest of all of our bones. And we're going to see a lot of the same features we saw in the humerus, but with slightly different names. The femur and the humerus do look somewhat alike, so it's not uncommon for students to mix them up. So before you even dive into all that nitty-gritty bone anatomy, make sure you can identify the name of the bone. So in this case, ID bone would be the femur. Now, just like the humerus, it has a prominent rounded epiphysis known as a head, and the head in this case would fit into the acetabulum of the os coxa that we just learned about. So if the acetabulum faces laterally, that must mean the head would face medially into the acetabulum. From here, just like in our humerus, the narrow part of our femur is known as the neck, but unlike the humerus, we only have one neck for the femur. So we just call it neck. There's no anatomical versus surgical neck. Okay, jumping back here, we are going to work on drawing our femur. So again, most of the time we're going to look at the posterior side of our femur. Starting with the head. And then we have the neck deep to that, or distal to that. Okay, let's talk about some of the other features that we see. If you remember back to the humerus had these two small rounded bony projections by the head that were called tubercles. But in our bone terminology lab, we learned that the femur has two large prominent bony projections that are called trochanters. And this is the only place in the skeleton that we will see a trochanter. We have a really big one called a greater trochanter and a smaller one known as the lesser trochanter. In the humerus, we have the greater tubercle and the lesser tubercle. And then in between the tubercles, we had a narrow groove called the intertubercular sulcus. Here, between my trochanters, instead of a sulcus, I have a large prominent ridge called a crest. And since this ridge is between two trochanters, we call it the intertrochanteric crest. So take a minute and say that one out loud. Intertrochanteric crest. It's a tough one, just like that intertubercular sulcus. And then if we move distally, I don't know if you remember, but in the humerus, we had a large rough area on the diaphysis where the deltoid muscle inserted. We also have a large rough area here on the femur where the gluteus maximus inserts, and that's called the gluteal tuberosity. And that should be posterior. Think about the gluteal region is posterior, so it inserts posteriorly on the femur. So here we have the gluteal tuberosity. And what we're going to see in the next slide is that this gluteal tuberosity is going to narrow out, and along the diaphysis on the posterior side of the femur, it's going to create a rough line known as the linea aspera, which translates to a line that is rough. And that's what you're seeing here. This thin, narrow, rough line running down the diaphysis of the femur is called the linea aspera. Okay, taking a look at the distal femur, we have two oval articulating surfaces known as condyles. The one that's on the same side as the head would be the medial condyle, and then the opposite one would be the lateral condyle. The shallow depression in the middle, known as a fossa, since it's in between the two condyles, it's called the intercondylar fossa. Between the two condyles, fossa. So say that one out loud, intercondylar fossa. Now, above each of the condyles, just like we saw in the humerus, we have bony projections known as epicondyles. This one here would be the medial epicondyle, and this one over here would be the lateral epicondyle. So let's go through and practice. ID bone would be the femur. ID feature would be lateral condyle. ID feature, intercondylar fossa. ID feature, medial epicondyle. And ID feature, lateral epicondyle. So let's draw a posterior view of our distal epiphysis. Okay, so we know the condyle on the same side as the head would be the medial condyle. Therefore, the opposite one would be a lateral condyle. Therefore, the two bony projections above the condyles would be the medial epicondyle and the lateral epicondyle. And that fossa in between the two condyles would be the intercondylar fossa. And I just want to make note, you can see that linea aspera coming down towards the distal epiphysis too. Now, the reason I wanted to point that out to you is because this linea aspera is going to split into two low ridges known as lines above the condyles. So I have one on the medial side called the supracondylar line, the medial supracondylar line. So that's saying a low ridge above the condyles on the medial side. Opposite of that, I have a lateral supracondylar line. And then that surface between the two lines is known as the popliteal surface. And this hopefully makes sense if you remember that the back of our knee is called the popliteal region. So here we have the medial supracondylar line. And then over here we have the lateral supracondylar line. And then the surface in between the two is the popliteal surface. Okay, the last part that we're going to take a look at is the distal ends of the femur, but we're going to take a look at it from an anterior view. So right distal, but anterior femur. Okay, so if this is a right femur, but we're looking at it anteriorly, what you are seeing here is the lateral epicondyle, and the medial epicondyle. Here, this surface, instead of being the popliteal surface, since we're in the front, it will become the patellar surface, because this is where the patella, the kneecap, articulates with the femur. So that is our patellar surface. And that's the last bit of the femur that we're going to cover before we cite it. So if we head back to our PowerPoint here and take a look at that. So anteriorly, the only major feature we're going to see is that patellar surface. So you do need to side the femur as right or left. If we're looking at it, again, giving me something anterior versus posterior, I like to use the gluteal tuberosity. Some people, so here's the gluteal tuberosity, and here's the linea aspera. I realize in a picture these may be both hard to see. So something else you can use, the intertrochanteric crest, or if you recognize this as the popliteal surface, all of those are posterior features. So as long as you identify one of those as being posterior, you're good to go. And then as far as medial and lateral go, I always like to use the head because the head should point in towards the acetabulum, so it should point medially. So knowing that I'm looking at the posterior side of a femur and the head's facing medially, I know that this is a right femur. Okay, as far as the kneecap goes, all you have to identify it as is the patella. You don't need to know apex or base. If I put this bone on an exam and it said ID bone, I would just simply expect that you said patella in return. Okay, moving on to the crural region, we have two parallel bones, much like what we saw in the antebrachium between the ulna and the radius. But in this case, we have the tibia and the fibula. The tibia is medial and the fibula is lateral. Going all the way back to Unit 1, if you remember, the fibular side of your crural region is lateral because when somebody fibs to you, you want to push them away. So what we're going to do is take a look at the tibia first, and then we'll take a look at the fibula. So if you feel the anterior part of your crural region or your shin, what you are feeling is the tibia, specifically this border right here, which is the anterior border. Now, do me a favor and feel for your patella on your knee, and then I want you to go just distal to that. And you'll notice that there is a bump below your kneecap called the tibial tuberosity. Your quadricep muscles, or your anterior thigh muscles, are going to cross over, cover the patella, and insert on the tibia at this tibial tuberosity right here. That's why it is so rough, because you have the quadricep muscles anchoring right there. So ID bone would be the tibia, T for tibia, but ID feature specifically would be tibial tuberosity. And then, as I mentioned, that sharp border that you feel in the front is the anterior border. Now, jumping distally, we have what's called the medial malleolus. Somebody thought it looked like a little mallet. This is that ankle bump that you guys see when you look down at your ankle. The medial big bony projection is, again, from the tibia. Just like we saw on the wrist, our wrist bumps weren't from the wrist bones. They're from the ulna and the radius. So our ankle bumps are from the tibia and the fibula. The medial ankle bump is from specifically, again, the medial malleolus of the tibia. Opposite of that, on the lateral side, and it's hard to see in this picture, but there is a little notch right here where the fibula will rest up against the tibia, which makes sense, right? If that notch is lateral, it's on the same side as the fibula, so fibular notch. Okay, let's step away from this real quick before we continue with the tibia and draw some of this out here. So we're looking at a right proximal epiphysis of a tibia in an anterior view. We've so far identified the tibial tuberosity. And this border right here, which is the anterior border. Then we jumped down to the distal aspect of our tibia. Where we identified our medial malleolus and opposite of that, the fibular notch. Okay, now we're going to jump back up to the proximal end of the epiphysis to finish talking about the rest of it. But the reason why I wanted to do the distal epiphysis first is because of this medial malleolus. Knowing that that malleolus is medial helps us to identify the condyles of the tibia. For example, this right here is the medial condyle because it's on the same side as the medial malleolus, and this right here is the lateral condyle. And in between, we have these two bony projections that form the intercondylar eminence, an eminence between the two condyles. If you've ever heard of the anterior cruciate ligament or the posterior cruciate ligament, that's where these are going to connect to, which is why they are projections, why they stick up. So going back here, I have and these are slightly concave, these condyles. So I have my medial condyle and my lateral condyle. And then in between the two, I have that intercondylar eminence. Okay, So the last thing we need to do for the tibia is to side it. So using the features we learned, a lot of people will either use the tibial tuberosity or that anterior border to find something that is anterior. And then as far as medial or lateral, the easiest thing I have found is that medial malleolus, and it tells you in its name that it's medial. So if I know I'm looking at this from an anterior perspective, and that's my medial malleolus, remember my inside ankle bump, I would know that this is a right tibia. Okay, the next bone is the fibula. The fibula is a long, skinny bone that doesn't really bear any weight. It's just there for muscle attachment. I'm not going to draw it out for you because we're only going to learn one feature on it, and it's this feature right down here, and that is the lateral malleolus, which forms that ankle bump on the outside of your ankle. So if I had a question and it just said ID bone, you would say fibula, but if it was pointing right down here, you would say, I would ask ID feature, and you would say lateral malleolus. Okay. That leaves us with the tarsals. So if you want, now's a good time to kind of take a break, go through the tibia, practice some labeling it, and when you are finished with that, you can come back and we'll finish up with the ankle bones and the foot bones as well as the toes. Okay, taking a look at our tarsals, which is another word for our ankle bones, it's a little misleading because these actually make up a good chunk of the foot. We have 7 tarsals compared to our 8 carpals, and they are as follows. The heel, calcaneal is the heel. So this bone that you see only part of here is the calcaneus. Sitting on top of the calcaneus, which is the heel, is the talus. This is what the tibia will sit on, specifically this part of the talus here, and this allows you to plantar flex and dorsiflex. But this entire bone here is that talus. Now, just distal to the talus, we have this bone here that looks like it's cradling it. This is the navicular. Lateral to the navicular, we have a cube-shaped bone here called the cuboid. And then the last 3 all have the same name, and those are cuneiforms. Cuneiform refers to a type, I believe, of writing that's kind of blocky in shape. So lining up with the big toe, or the hallux, if you look down at your own feet, your hallux is medial. This would be the medial cuneiform, meaning the one over here would be the lateral cuneiform, and then the one in between would be the intermediate cuneiform. So let's take a moment and draw out these tarsals on our Word doc. So this is going to be a superior view of the foot. So you're looking at the dorsum of the foot, if that helps. This will be medial over here, and this will be lateral. So we have that calcaneus, which is my ankle bone. And on top of that, we have the navicular. On top of that, we have the talus. And then cradling the talus, again, we have that navicular right here. And then next to it, we have that cuboid. And then we have 3 cuneiforms. 1, 2, and 3. So we have our medial one, our intermediate one, and then our lateral one. Okay, from here, the metatarsals mimic the metacarpals, and the phalanges act the same way as they did in the hand. So, the metatarsals are the remaining bones in our foot. We're going to start with number 1 as the hallux, so metatarsal 1, or you can write the 1 up here. This would be ID bone, metatarsal 2, ID bone, metatarsal 3, ID bone, metatarsal 4, and ID bone, metatarsal 5. And then our phalanges, again, work the same way as they did in the hand, where we have 1, 2, 3, 4, 5 proximal phalanges. And again, if we were identifying just one of them, it would be phalanx. We have only 4 middle phalanges. And then we have 5 distal phalanges. So again, that hallux is missing the middle phalanx. So let's draw that into our foot, and then we will be done. So in orange here, I have my metatarsals. And then in my toes, I have my proximal phalanges. I'll write the singular form since that's how you would answer on an exam. I have 4 middle phalanges. And then lastly, I have 5 distal phalanges. Okay, that finishes our foot. If you have any questions about the material we went over, please do not hesitate to ask me. Again, the anatomy physiology reveal, the cadaver tool is really awesome for the skeletal system because it highlights all these features for you and it gives you a more realistic feeling than my drawings and the pictures that I use.